therapist or speech pathologist is trained to work with several different types of disorders. We can work with speech articulation, language development or language rehabilitation after a stroke or head injury, memory, cognition, thinking, also swallowing and voice and fluency. Many people don't think about their voice until they've lost it. And generally, if you've lost your voice, just be kind to yourself. Be gentle to your voice. A voice often mirrors how we sound and how we feel. If we are sick, our voice will feel and sound sick. If you do lose your voice, there's something that you may need to change. Look at what caused you to lose your voice. If you were yelling at the football game or singing too long and too loud, cut back and pull back on that. If you have lost your voice and it hasn't returned within a week or so, your physician might refer you to an ear, nose, and throat specialist, an ENT. The ENT will take a look down your throat into your voice box or your larynx and look at the vocal cords directly to see if there are any lumps, bumps, or bruises. An ENT or voice specialist or speech pathologist uses different measures to analyze voice. First, we have a direct view. We visualize the vocal folds. The ear, nose, and throat doctor will look directly at the vocal cords to see what the structure is. We can then use our ears and listen to how a person's voice sounds. Another way to assess voice is using stroboscopy, where we have a camera and a flashing light or strobe light that measures how the vocal folds move during vibration or voicing. After the voice assessment, a voice therapy program will be developed to help you return your voice to strong and supportive and healthy. It may involve exercises, and like any exercises, you actually have to do them in order for your voice to get better. It also may involve learning and changing your voice to include healthy vocal behaviors. It's a matter of moderation when it comes to your voice. Too much yelling, singing, crying, shouting can also hurt your voice. So the opposite goes. A healthy vocal behavior may include speaking softly, talking less, being more mindful of your environment that you're talking in. These are all things that can help your voice stay strong and clear to help you communicate as best as you can. Christiana Care is the place of firsts. We're fortunate that we have the equipment to provide the services in voice assessment, specifically stroboscopy. We're the first hospital in the state to provide stroboscopy to adults. We actually have a huge department of speech pathology. It's unusual to have such a large team of speech pathologists. We work well together. We each have different strengths and capacities. We collaborate with each other on our patient plan of care, and we work well with the doctors and our teammates.